I would say, from my organisation, really to have more engagement from the top down, really, because they're lawyers and their focus is on earning fees, and so it is trying to persuade them to focus on other things that are sort of high up on the agenda of other organisations that ultimately will benefit their employees, really.
I think mine's a big ask because we don't really have anything in place. But my ideal position would be to have a wellbeing provider, and I use the word wellbeing, because who understands what kind of charity we are and the kind of challenges we have in terms of the diversity of our staff. But I also agree with what Lisa says. It's really important that that's backed from the top, and I think there's a disengagement there.
I think mine goes back to the challenge of having such a geographically diverse workforce, because we're really keen to introduce some of the other kind of wellbeing initiatives that we've heard that work really well, where you've got everybody at one site and you can offer something. We're obviously very limited, and we can offer that to the 10 people in the office, but we can't go out to a client site and do that at somebody else's business. So I think if there was a way we could get over that to do some of the things where we can share information and perhaps introduce some initiatives, that would be great.
Yeah, I'd agree with Bims really that not having something in place, it would be really good to be able to convince and, well, having had this discussion, to be able to present the data, be able to present the findings, to be able to get that sign-off really. And I think just some of the discussions today has helped in terms of you're not alone doing it, you actually can have providers that can support you in doing that and all the tools. So yeah, that's been useful.
For me, from the reward perspective, it's probably I'd like more data. So it's not the big things, it's the little things, knowing what tweaks you can make, what the impacts are those, getting more feedback in place. Because there are, as I think we've all kind of talked about today, there are no simple answers. There's no one-shot solution that will fix everything. It's about a holistic, integrated approach across all things. And you can only tell if those things are working by having more data about what the impacts are.
Mm-hmm. Pete, what kind of progression would you like to see in workplace wellbeing and healthcare?
The big one with cash plans has always been, I think Alex, you mentioned it, about face-to-face. Where we have successful launches, and let's take company paid out of this slightly, because if the company's paying for it, they're all in it anyway, aren't they? And yeah, they can top up if they want. I'm more on the voluntary side. It's a real challenge if we've got a great product and we're not allowed to present it to employees. So the more access we've got to employees, the better the take-up of that product. The other one for me is a little bit like you've just mentioned. It's about how do we get the message right to the boardroom. I mean, there's a lot brokers can help with this, and we as suppliers can help with this. You'd be surprised at how much you spend on, say, duty of care things like VDU, eyesight tests, that kind of thing. That could be diverted back into a healthcare product. A paid for cash plan will cover your VDU usage for eyesight tests and so on. Most of our products have EAPs built in, and if not, at least a telephone helpline. So you may be paying separately for a telephone helpline, separately for eye care, and all of a sudden somebody can come along and say, well, actually, 2/3 of what we're going to charge for this, you're already paying. Now, that's a different conversation to have at board level now, because actually all you're doing is diverting some of the budget you've already got. And I think it's conversations like that that I'd like to have, shall we say, a clearer path through.
Mm-hmm. Well, I think the key is talking to each other, and it's great that we're all here today talking about this subject, because I don't think it's really been done very much. There's a wellbeing movement that started in London. A gentleman called Stephen Haynes started it. He's the founder, and it brings people together to talk about what we've been talking about today. I'm just about to start up the same movement in Bristol as part of his initiative. And what I hope to achieve is to have these sort of conversations, share ideas, and hear what the sort of problems are that you've been facing. Like you say, there isn't a one-stop solution, but I mean, research recently done by NICE, the National Institute for Clinical Excellence, talked about line managers. Their top 4 areas, for well-being was let's train the managers. So I think there's a lot of work that can be done there to help this. But I think ultimately helping HR as an intermediary is something that we need to learn. And I think, I would encourage you to go back to your brokers and say, what can you do to help? Because I'm sure they can.